Let's cover a few safety tips to keep in mind when operating the warmer. Always preheat your warmer, so it's ready to go when your patient arrives. The warmer has a warm-up mode that will operate at 100% power for 7 minutes, then automatically reduce to 50%. There are no alarms during warm-up, so the baby should not be placed in the warmer until after warm-up mode is complete, or you've hit Admit Baby or APGAR on. Again, when placing a baby in the bed, you should press the Admit Baby button. On the Panda warmer, you can press Admit Baby or start the APGAR timer. Both buttons put the warmer into manual mode and allow you to set your heat output. Per hospital protocol, place a skin temperature probe on the baby and switch to baby mode, or continue to monitor the baby in manual mode. Again, the baby should not be placed in the warmer during warm-up mode. Once the patient is admitted, do not keep the warmer in manual mode at 100% power for extended periods of time. You can use manual mode with the temperature probe to monitor the patient's temperature, but remember, it will not control the radiant heater output in manual mode. You must be in baby mode to have the radiant heater output controlled by the baby's skin temperature probe reading. It is important to verify the patient's temperature periodically with a secondary monitor, such as a thermometer. Using a skin temperature probe is recommended. Ensure it's connected to the skin temperature probe jack of your bed. Here are some tips for placing a temperature probe on a baby. Place the temperature probe securely on the reflective patch, and then securely to the patient's skin, pressing and holding to ensure good contact. It can be placed on the back or abdomen, depending on if the patient is prone or supine. Alternately, consider placing on the axilla. The reflective patch should be reflective foil side up. Both the disposable and reusable temperature probes should be placed this way. Do not use the temperature probe without the reflective patch. It is very important that you only use GE Healthcare temperature probes with your warmer. Using probes from other manufacturers may cause inaccurate temperature readings, as they have not been verified by GE Healthcare for use with your equipment. Do not place the probe between the baby and the mattress. A few other things to keep in mind about temperature probes. There are 2 types available: reusable and disposable. When packaged together, disposable probes come with a smaller heat-reflecting patch already attached and are white. Disposable temperature probes can be cleaned for point-of-care cleaning on an individual patient. Do not reuse disposable temperature probes. The reusable probe has a round metal disc at the patient end. Remember, when wiping clean, start at one end of the probe, the tip or the plug, and clean the probe by moving the cloth towards the middle of the probe cord to the other end. Do not start at the middle of the cord and move the cloth towards the plug or tip end of the probe. This may stress the connection between the cord and the tip or plug due to an abrupt stop when reaching the tip or plug. Take care not to pull on the probe wire. When storing the reusable probe cord, do not stress the connection between the cord and the plug or tip. Do not tightly wind the probe cord or sharply bend the cord at either the tip or the plug end. This is how to store the reusable temperature probe. When doing kangaroo care, maintaining the baby's temperature is important. Here's how to set up temperature alarms when doing kangaroo care. Press Menu, Setup, Next, Man Temp Alarm. Remove from Off by selecting 0.5 degrees Celsius or 1 degree Celsius. This will set the alarm compliance limit at either 0.5 degrees Celsius or 1 degree Celsius. This will enable the system to notify you when the patient's temperature changes beyond your chosen limit in manual mode, while the parent is holding their baby. Temperature control is important and should be monitored and maintained closely. Adjust baby mode temperature as necessary to get the correct temperature at the remote measurement site, such as the axilla or rectum. Here are some reminders for optimal temperature monitoring. Observe the patient frequently, looking for signs of heat stress, such as skin redness, warmth to touch, diaphoresis, or increased heart rate. Check the patient's temperature at least every 2 hours with an independent temperature measurement at a remote site, such as the axilla or rectum. If the patient shows more than a typical 0.5 degrees Celsius or 0.9 degrees Fahrenheit difference between the warmer abdominal skin temperature and a remote site, such as the axilla or rectum, consider the following actions. 1. Verify the skin temperature probe has a good skin contact, using a reflective patch. Consider moving the skin temperature probe to another site, such as the axilla, and continue to monitor the patient's temperature. Adjust the baby mode set temp as needed to meet the desired temperature at the independent measurement site, such as the axilla or rectum. If temperature concerns are not resolved, place the warmer in manual mode and adjust the heater power as needed to meet the desired temperature per independent measurement, such as the axilla or rectum. However, baby mode should be used whenever possible. Do not place tubing and hoses in the path of the radiant heater. Remember, do not touch the heater element, reflector, grill, or exhaust duct on the back of your warmer.